Is it trigeminal neuralgia, or is it a problem coming from the upper neck where the brainstem sits? Trigeminal neuralgia is one of the most painful conditions known to man. Sharp, shooting, electric-like shocks in the face, the gums, and the nose. It can be triggered by wind blowing, brushing your teeth, or even laughing. Even just speaking or chewing food can be the most painful thing you can do. One of the major surgeries to treat this is microvascular decompression, which is a major surgery through the skull. And even after the surgery, people are still suffering from trigeminal neuralgia. A natural, non-invasive way to treat trigeminal neuralgia is through upper cervical specific chiropractic care. An upper neck misalignment around the brainstem can disrupt the signaling to the trigeminal nerve and cause many of the trigeminal neuralgia symptoms explained before. What we do in our office is take advanced x-rays of the upper neck to figure out how that top bone is shifted out of place, which is causing the interference in the trigeminal nerve, and we put everything back in place precisely where it needs to be. There's no twisting of the neck at all, and the adjustments are designed to hold and stay in place so you get the proper nerve flow and blood flow back to the trigeminal nerve and dissipate symptoms of trigeminal neuralgia. Comment below with your city and zip so we can find a doctor near you.